Well, at least we both got here on time today.
Yes, that we did. I'm giving it like one more minute for people to join and then I'll get started.
All right.
All right, I'll go ahead and get started. Thank you guys for being here. My name is Nicole Gibbs. I'm going to be talking about subclinical bacteriuria. I'm one of the ACVNU residents. I apologize if you tried to attend when this was originally done in July. The clinics got a little crazy, but glad you guys were able to join today. So this is based off this study in the Journal of ACVMA, so JAVMA article that is talking about subclinical bacteriuria as a non-progressive but persistent in dogs 4 years or older recruited in small animal primary care. This study was done a couple of years ago out of North Carolina State University. All right. So some background on subclinical bacteriuria. The definition of it is the presence of bacteria in urine in the absence of any clinical evidence of infectious urinary tract disease. So no pelacuria, stranguria, hematuria. For these guys, just the presence of bacteria without any signs of them to the owners. The reported prevalence in healthy dogs is about 2 to 12% in prior studies. And with comorbidities, it depends a little bit on what comorbidity it is, as well as how the study did that. But it was anywhere between 18 and 74%. So quite a large range for dogs with comorbidities, including like endocrinopathies or immunosuppression. The challenge with our patients is, are they truly subclinical? Or, if you have an owner that doesn't necessarily watch their dog go to the bathroom very often, or, has a yard that they just let them out in the yard, sometimes they're not quite clear the last time they did see that dog urinate. And so we have a bit of a challenge in determining, like, is this truly subclinical for this dog? Or is it possible that the owner's missing the signs for it? The ISCAD guidelines in 2019, which was, I think, one of the first instances of this, advised against the treatment of subclinical bacteriuria. And they note that even if the animal is pyuric or has a high bacterial colony forming unit per mil on their culture, that they would still recommend not treating if the patient is subclinical for it. So if they don't show clinical signs for it. And that's based a lot on human medicine, but also some things that are being done in veterinary medicine. There are some downsides of treating subclinical bacteria, one of which is microbiome disruption. So anytime we're giving antibiotics, we will change their flora, not just of their GI tract, but also urinary flora for them. Subclinical bacteria can be less virulent sometimes too and help outcompete more of the pathogenic bacteria. And so it may be that treating this might allow for more virulent bacteria or more pathogenic bacteria to kind of take over instead of this one that isn't causing any clinical signs. So the microbiome disruption is a big deal in ours. There's also, antibiotics are not always benign, especially depending on which type of antibiotic, but all of them have, GI side effects as a potential for them. And then also the cost to owner, so treating it, following up with urinalysis and urine cultures, sometimes all of that has a cost to the owner, which, if this dog doesn't necessarily need it, would be a downside of treating subclinical bacteria. In addition, the more we're using antibiotics, and for them, there is possibility of antimicrobial resistance to be developed. in the urinary tract, but also just in general. If this patient does need antibiotics in the future, they may or may not be susceptible if they've already been exposed to recent antibiotics, especially for one that might not be helpful for them. And then often in subclinical bacteriuria, if they have a predisposing condition, but maybe even if they don't, there can be reinfection that occurs with them. And so we often, if we are treating subclinical bacteria, we would be continuing to treat those reinfections despite clinical signs and kind of increase resistance that way as well. When kind of looking at this, there is limited evidence for how subclinical bacteriuria progresses. And I think that's why a lot of clinicians or everyone gives a little bit of pause on, we feel sometimes compelled to treat these dogs, even if they don't show clinical signs, and I feel like if you ask clinicians, it would be mostly because we're worried about what's going to happen with that dog for them. So this was a new guideline, as I mentioned in ISCAD of 2019, that we're not treating subclinical bacteria, but you can see that sometimes in practices, this is still being performed for it. And I don't think any polls have been done, but I would guess if you ask people what are some concerns of not treating subclinical bacteria, would be that they go on to actually develop cystitis, so they develop those signs, or do they have more abnormalities from that? So do they get an ascending pyelonephritis, which has more mortality than just a cystitis? Do they develop urolithiasis, especially depending on which bacteria we're not treating? So if we are not treating urease producer, could we be setting them up for urolithiasis? Could they develop prostatitis, particularly in our intact males if we're not treating them? And then concern for like kidney disease, mainly based off the pyelonephritis component of that, or progression of their kidney disease if they have bacteria and they're a chronic kidney patient. In the studies, kind of across all studies, including in different comorbidities that have been seen for subclinical bacteria, E. coli is the #1 bacteria that's isolated in these cases. There hasn't been many studies that looked at the FIMH gene. So that is a gene that plays a role in biofilm and helps bond to the uroepithelial surface, kind of allows these pesky recurrent UTIs to continue to be there because they aren't able to, they film this biofilm and then they're not able to fully clear that infection. And they do this by binding to D mannose for the uroepithelial surface for them. So FIMH gene is one that people are worried about as far as recurrent urinary tract infections. Not many studies have looked at this particularly. They have found that the subclinical bacteria seems to be inversely correlated with antimicrobial resistance, meaning that the ones that are pathogenic tend to be more susceptible, which is good news for us, and the ones that are more resistant tend to be less virulent, so less likely to cause our clinical signs based on prior studies, which is overall good news for us, that we don't necessarily have the really pathogenic and really scary resistant ones, although I'm sure we all have had those in our practice. So they have seen other bacteria. So as I mentioned, E. coli is the #1 bacteria that is isolated when looking at subclinical bacteria. Other bacteria that are isolated include Enterococcus, which I feel like it does tend to be there with kind of other lower urinary tract diseases, not always pathogenic, as we know. Staphylococcus are fairly common, and then Enterobacterialis, including like Klebsiella and Proteus, not as common, but does occur, and same with Streptococcus. So kind of those are the main isolates that have been found in prior studies in dogs. So when looking through the literature of subclinical bacteriuria in veterinary patients, there's been several studies looking at this with particular comorbidities. So in chronically paralyzed dogs, they found about 3/4 of them had a positive urine culture, and about 1/3 of them were found to be recurrent. Pyuria was associated with a positive culture. It's not overly surprising. The look of the urine is not associated with positive culture, so just because it looks cloudy does not mean that they have a urinary tract infection. But they did find, when looking at whether urinary tract infections or this bacteriuria was implicated in survival, they found no difference. So having that bacteria be present as a subclinical didn't mean that they had worse mortality for them. So possible that we don't need to necessarily treat them them for that condition, but these are obviously very challenging to figure out, are they clinical or subclinical for their bacteria? Another disease that's been looked at is diabetes mellitus, out of a JVIM article in 2023. Found that about 14% were positive on culture, and of those, half of them had pyuria, and about 4 out of 15 had lower urinary tract signs. Interestingly, they found that there was no correlation between the urine culture results and the signs of lower urinary tract disease. So dogs that did not have a urinary tract or that did not have a positive culture could have lower urinary tract signs noticed by the owner for them. So just kind of an interesting thing that the lower urinary tract signs does not necessarily indicate that they will have a positive culture, although something that we will look for on them. Chemotherapies have been also evaluated for their presence due to concern that, if you immunosuppress the patient and they have subclinical bacteria, could we be setting them up for a higher morbidity infection, such as pyelonephritis? For them, they found of all dogs getting chemotherapy, about 11% had a positive urine culture, but there was no influence on the chemo on whether they had a positive culture or not. So they had 11% at the start and 13% during treatment had a positive culture, and there was no difference between those groups as far as that chemotherapy doesn't necessarily increase their risk of having bacteria. And then Cushing's disease is another one that's been looked at for them, and they found about 12% had subclinical bacteriuria of the ones that they had, and only 4% had actual bacterial cystitis. And these actually were all in well-controlled hypercortisolism cases. So the ones that were not well controlled did not necessarily have bacterial cystitis. They were actually in the ones that had good clinical response and good control of their disease. Whereas I think, as you would expect, that the subclinical bacteria would maybe be more prevalent earlier on when they're not controlled, but that's not what they found in this study. About 3/4 of the cases did kind of cure of their bacteria in their urine. However, there were persistent infections. So of that quarter that did not clear, all of them were subclinical bacteria cases. So none of the cystitis cases didn't clear with antibiotics. And then on to kind of chronic kidney disease, when we think about this quite a lot for ours. So mainly looked at in dogs for them. There's 2 studies that's been done. The first one's at JVIM 2018 that was done with J.D. Foster. In 18% of dogs, they had a positive culture with CKD, with about 50%, almost 50% being subclinical bacteria for them. However, notably, 40% of those did have pyelonephritis. The CKD stage, though, was not associated with the presence of bacteriuria or the disease category. So the later stages in disease does not necessarily increase the risk of subclinical bacteria or like of the other cystitis cases. And then looking at CKD at stage 2, this one had a higher percentage that had a positive culture. There was 32%, so about 1/3 of cases with CKD in that group had a positive culture. But even though they had a higher positive cultures, less percentage actually had UTI signs, so 8% for them. Females were more common, which I think is not surprising for us. And they did find that if that patient was isosthenuria, they were more likely to have a positive culture than if they had some concentrating ability for them. So that sums up what we kind of know about subclinical bacteriuria in veterinary medicine, or in dogs in particular. And so what we know about it is that we know them in these disease states. We know kind of overall prevalence of subclinical bacteria, but there really hasn't been that many studies that look at what happens when we ignore when we ignore this bacteriuria, what happens afterwards for them. And so that was one of the study objectives, was to describe clinical and microbial outcomes in dogs with untreated subclinical bacteriuria for them. So this study, as I mentioned, is out of North Carolina State University, and they have a primary care service who did this, who was part of the study. They recruited prioritizing middle-aged to older dogs for them with greater than or equal to 4 years of age when they recruited. They defined dogs and kind of put them in their life stage categories, so young or older. They had weight categories and age cutoffs so that they could categorize them. Dogs were excluded if they had antibiotics within the last 30 days, or they did have signs of lower urinary tract disease, so they would no longer have subclinical bacteriuria, so those were excluded at that time. So the first phase of the study, day 0 was kind of their initial study visit. They did all of the consenting for it, confirmed verbally that they had no urinary tract signs, and then they were sent an online survey that had to document like how often the dog was going to the bathroom within the last 7 days. Did they notice any straining? So kind of other than verbal confirmation, they also had them confirm on the survey that these dogs indeed did not have clinical signs for them. They got general information about the dog. So did the dog have a comorbidity that might predispose it to urinary tract infections? So things like kidney disease, urinary incontinence, endocrinopathies, or immunosuppression. They did a physical exam on the patient, and then they did a cystocentesis with UA, with the urinalysis for them. When they first looked at them, bacteriuria was identified on a wet mount urine sediment, and then if they noted bacteria, then it had to be confirmed on a dry mount urinalysis and a positive culture. And if it was if they had bacteria, then it was sent for culture. And if that culture was positive, it was defined as colony-forming units greater than 1,000 per milliliter. So as I mentioned, if there was no evidence of bacteria on the urine sediment, these patients were excluded. They did not get a urine culture at that time for them. That's based on studies that have previously shown that if there's no bacteria on a urine sediment, the odds of getting bacteria on your culture are quite low, and often sometimes are contaminants then after you go through the culture process. So after day 0, the owners had to complete a survey weekly on urinary tract signs. So again, confirming that these are subclinical bacteria, that they are not developing signs of them. And then on day 28, which was the last stage of this one, they again had a physical exam, and then cystocentesis with UA, and then culture if they had bacteria. So same thing for it there. This is just a visual representation of this that goes through the table. So the X marks as what they did on that day. So you can see they did the same thing on day 0 and day 28. And all of this, like the survey was what they did in between those 2 times. For phase 2, they enrolled dogs at least 60 days after the first phase of the urine sample. So they took their dogs from phase 1 that had subclinical bacteria and then grouped them into phase 2 for whichever one's elected to do that. They had days they were seen, so similar to day 0 and day 28, they had a new day 0, day 60, and day 120, where they did the same thing. They did physical exam, cystocentesis with urinalysis, and then culture if it had bacteria. Additionally, instead of every 7 days, which they did for the first month of the study, they did it every 2 weeks, mainly probably to avoid some owner exhaustion of doing a ton of surveys for them. So they did every 15 days, so twice a month for them. And this was, again, just a representation of what was done during this time. So you can see phase 1, as we talked about, and this is phase 2 here. So at 0, 60, and 120, they did the cysto and urine culture for them. And then at every 15 days, they just did the survey for them to monitor for the dog developing clinical signs. They also wanted to look at antimicrobial susceptibility. So multi-drug resistance was defined as resistance of 3 or more drug classes. They had methicillin-resistant staphylococcus that was confirmed with PCR detection of MEC-A and MEC-C. They looked at extended spectrum beta-lactamase producing enterobacteriales by PCR detection of other genes. And then for every E. coli, they also were looking at the FIM-H gene via PCR. So as you might remember from earlier in this presentation, that one's the one that's associated with biofilm formation for it, and the one that binds to D-mannose to kind of hold onto the bladder wall more firmly. So they wanted to see if that was present in them. For their actual analysis, they did mainly a descriptive analysis, describing what was the persistence and resolution of subclinical bacteria, did they develop bacterial cystitis, and then what bugs were actually cultured, so which bacteria there were. And then they looked at categorical variables with the Fisher exact test, and continuous variables with Mann-Whitney-U test. All right, now onto the results for it. So they enrolled, where they screened 156 patients, 99 of which were enrolled. They excluded 56 of them for a couple of reasons. They either withdrew consent for the follow-up, the urine couldn't be collected due to this small bladder, or the patient was not very happy to have that cystocentesis done, and there was like needle reactivity. And so they were excluded if they met any of those categories for them. So they ultimately consented to 100 dogs, or for them. One didn't do the survey, so they got excluded, down to 99 for them. So you can see we're here now, that eligible 99 dogs for them. Of these, 11% had subclinical bacteria, so we're down even a little bit lower, unfortunately, with 11 dogs total having subclinical bacteria. Of all of the dogs enrolled, it was about 50-50 split with female and male, middle-sized dogs about 21 kilograms, and middle-aged dogs about 8 years of age. Of the ones that had subclinical bacteria, slightly older than the median, about 9 years, slightly bigger, 23 kilograms, probably not significant for them. And then all of them were spayed female dogs, so none of the neutered males or no males had the subclinical bacteria. It was only females in this study. And then the majority of these were in the senior or geriatric life stage. So this is a big table, and you don't have to know all of it for it. This is just mainly talking about signalment, what sex was included. So all females, which you can see here, 100% of the ones subclinical bacteria were there. Looking at comorbidities, there was 2 patients that had urinary supplements, and that was actually found to be significant. So if they're on a urinary supplement, they were actually more likely to have subclinical bacteria for them. However, is that because they already had some history of urinary tract infections, or they had something else that made them earlier beyond urine supplement? I don't think the supplement themselves is probably predisposing them to have the subclinical bacteria, but I thought that was an interesting finding on this study. Then I think the other thing to just notice, so they looked at these comorbidities, but you can see the sample size on this is quite low and probably is underpowered. So only one of their dogs had kidney disease, none were on cyclosporin, only one had Cushing's, and one was hypothyroid. So overall, fairly low comorbidities in that 11 group for them. So hard to make, a wide-reaching conclusion from that. So, but what they did find, and kind of one of their conclusions, was that dogs with subclinical bacteria were more likely to be female, because as I mentioned, all 11 dogs that did have bacteriuria were females, and to be using a urinary supplement, which I think is just kind of an interesting finding, but potentially it's like selected for based on their prior history, which I didn't see in their study. The other thing they concluded was that of the dogs that had subclinical bacteria, so all 11 dogs, none of them had urinary tract signs during phase 1. So for 30 days, those dogs did not have any signs of urinary tract infection. For the microbiologic outcomes, they had 10 of the 11 had bacteria on both days. One dog had a lactobacillus, not very common for urinary pathogen, but that on day 0, but then wasn't repeatable on day 28. So potentially some contamination or something along that line for the lactobacillus. Hard to know what to make of that. Of the ones that had bacteria, they had the same genus and species in 9 out of 10 of those dogs. So one dog had a switch of bacteria for them, but the other 9 had the same bacteria over that 30-day period. Or sorry, that 28-day period. And then one was found to have some antimicrobial resistant, but to one drug class. So a staph pseudoneuritis that was resistant to beta-lactams for them. Of the E. coli's that they cultured, all of them were positive for the FIM-H gene, so they were positive for that biofilm producing one. This is a table that they included that just has what bacteria were there. So you can see E. coli is again the most common bacteria identified for subclinical bacteriuria. You can see lactobacillus, they had the one, but then was not present at the next time over here for them. And only one of them was resistant to the beta-lactams. So then they went on to phase 2 for them. So unfortunately, only a little less, or a little more than half of them went on from phase 1 to phase 2. So the other 5 dogs were kind of dropped out of the study after phase 1. They had a median of 90 days after phase 1. They underwent their first phase 2 physical exam and cystocentesis. And then they had a urine culture performed over a medium of about 237 days. So about 2/3 of a year from their first sampling, they had more data from that. The clinical outcomes of this are a little hard to interpret because half of the dogs were actually prescribed antibiotics during phase 2 of this for various reasons. So one dog was prescribed antibiotics for bronchopneumonia, and that cleared their subclinical bacteriuria as well. So kind of a 2-for-1 on that one. There was a tooth extraction. They only got 1 dose of cefazolin and it didn't clear. Not too surprising, so they only got 1 dose. And then one of the participants was a veterinarian and treated their dog that had subclinical bacteriuria. So they, I think, did not like that the dog had bacteriuria. So they treated it even though it did not have clinical signs of urinary tract disease. There was kind of one really interesting one. So that was given antibiotics for urinary tract signs. So this dog presented and had pyelonephritis about 300 days after enrollment, had urinary calculi in the kidney, bladder, and ureter. And this dog also had a historic liver insufficiency managed for about 3 years prior for it. So one of their dogs did develop pyelonephritis. So that's this dog B for it. That's up at the top of this table. So it had E. coli and was treated with enrofloxacin. Unfortunately, it only got 1 dose because it was euthanized at that time. Interestingly, they did note throughout the cultures that there was a change in flora with inconsistent proteus growth for them and did have these calculi that were found. And then potentially cholangiohepatitis, a little hard to know because the dog also had underlying liver insufficiency for it. As I mentioned, one had it prior to tooth extraction. This one did not clear, so had persistent subclinical bacteriuria. The ones that were treated for bronchopneumonia and then for their subclinical bacteria both resolved their subclinical bacteria. So both of them were clear after antibiotics. The ones that did not receive antibiotics or receive kind of an inadequate dose of antibiotics all had persistent subclinical bacteria for it. So those were the main results for it. So some conclusions from them other than what kind of they stated. So female dogs are more likely to have subclinical bacteriuria. And they didn't find comorbidities being different between dogs with and without subclinical bacteriuria. However, I will say that is limited by their study size. They had very few dogs that had comorbidities, so I don't think that's like a statement that can actually be made from this. I think we would need a larger study and more dogs with subclinical bacteria to actually make a statement on whether comorbidities increase the risk of subclinical bacteria. Of the 11 dogs, 10 out of the 11 did not have progression of subclinical bacteriuria. However, many of them were just done for 1 month period of time, so not necessarily had a long-term follow-up. There was only 6 dogs with long-term follow-up, and half of those were treated. So I think it's a really hard thing to know and to make any long-term, unfortunately, hard to make any long-term conclusions from this subclinical bacteriuria. I think importantly to note is that one of them did have a significant complication related to their urinary tract infection or from their subclinical bacteria with having pyelonephritis. And that may be more of a concern for the stone-forming bacteria like Proteus. So just something that I think needs to be further evaluated is is every subclinical bacteria, should it all be ignored? What about those stone-forming bacteria? Should we be doing something different about them? What's their risk of stone formation? I just don't think we know that information. And this is a 1 dog, so really hard to make any major conclusions based on that. Again, E. coli is the most common of the subclinical bacteriuria. Dogs all tested positive for that FIM-H gene, so they're the ones that form these biofilms. and tends to have a negative correlation with the presence of antimicrobial resistance based on prior studies that have been done. The other thing that I think is a good takeaway from this is that most of the subclinical bacteria did not change over time, but did have a fluctuation in the concentration of the bacteria. So their CFU per mil did change throughout the course of that of the study, but most of them had the same bacteria at each time point with some exceptions. Some limitations of this study. So as I mentioned, this was overall a very small group that received the long-term follow-up. And unfortunately, half of them that had the long-term follow-up did receive antibiotics in that time period, with 2 of them clearing their bacteria. There was a limited population with comorbidities. So, and these are often the ones that unfortunately we worry about the most. So the ones that are immunosuppressed and the ones that have these other diseases that may become uncontrolled. Those are the ones we're often worried about, and there's not that much population within this, but I think it is a good study that looked at kind of primary care situations for this and kind of our older dogs that might have these subclinical bacteria. The other thing was that baseline blood work was not performed to assess for comorbidities, so unknown a little bit what dogs had which comorbidities other than ones that had them in their history. I think there's a lot still to know about subclinical bacteriuria that would make us all feel probably a lot better to know is looking at subclinical bacteria with a focus on the urease producing bacteria. So evaluating, do those become urolithiasis over time? Do they become clinical, or do they kind of hang out and not cause any problems for them? Because I think those are ones that I definitely at least keep in my mind and kind of warn owners sometimes about, is if I'm not going to treat one that is a struvite former, to know that that's kind of a risk of not treating that disease. Thankfully, most of them are E. coli, so not as big of a deal for struvites. Also looking at how evaluation of subclinical bacteria progression in dogs with significant comorbidities that might pose a risk. So chronic kidney disease and the ones that get pyelonephritis, and immunosuppressed dogs, and how that kind of affects what happens to these dogs over time, and does it progress to pyelonephritis or not. Owner perception of us not treating these dogs, and because I think even in this study, one vet wanted to treat their subclinical bacteria, so I think it'd be interesting just to know what owners are thinking about us not treating these diseases or this condition. And then more work to be done, as usual in veterinary medicine, on cats, because there's just not that much information on cats out there and how prevalent subclinical bacteria is and in different conditions for it. That was kind of my take on the study. I don't know if anyone has any comments, questions, thoughts, or just comments on how you treat subclinical bacteria. Or if you don't and not treating it, any thoughts on it?
Thank you, Dr. Gibbs. I just wanted to kind of share the concern, I guess, of, if you've got a staph or a proteus with highly alkaline urine in a dog with some other predisposing factor for forming stones, those are the ones that make me nervous to leave them alone. pH is 8.5 with a strong urease producer. I think those are concerning. But do we have data? No. Do I have anecdotal evidence? Yes, but that's anecdotal evidence. So
Yeah, I agreed. I think those are really tricky, and I would love some more information about what happens to those over time. I know they're not as common as the E. coli's, but I think those definitely give me pause as well for them of what's going to happen in the future for those animals. Any other questions, comments, thoughts?
Well, if nobody else has anything, we'll go ahead and end it. Thank you so much, Dr. Gibbs.
Great, thank you guys.
Have a great day, everybody.